Before 1880, if you were sick and broke in America, you didn't die outside a hospital. You were treated for free. No insurance, no bill, no questions. There was a system of marine hospitals funded directly by the federal government, stretching from Boston to New Orleans. Sailors, workers, the poor, all covered. Then one bank got involved, and within a decade, it was gone. Here's the story they never put in your history textbook. Full breakdown in the video. Most Americans think universal health care is a modern idea, something imported from Europe. But here's what they don't teach you. The United States had a functioning public health system as far back as 1798. It was called the Marine Hospital Service, and it was remarkably simple. A small wage tax, about 20 cents a month, was deducted from every sailor's paycheck. That money funded a national network of hospitals along coastlines and river ports. These weren't charity wards, they were real medical facilities. And they didn't just treat sailors. Over time, they served workers, immigrants, and the rural poor. At its peak, this system had over 30 hospitals operating across the country.
The genius of the Marine Hospital Service was its funding model. It didn't rely on charity. It didn't rely on the mood of politicians. It was a mandatory payroll contribution, the first of its kind in American history. Doctors were employed by the government, hospitals were owned by the government, and the people who needed care just walked in. By the 1870s, reformers were expanding the vision. Some wanted to extend it beyond sailors. There was real momentum towards something much bigger, a national health infrastructure open to all Americans.
Here's where the story turns. After the Civil War, American banking was consolidating at a frightening speed. The country's financial elite, centered in New York, were gaining enormous influence over federal policy. The Marine Hospital Service was sitting on something valuable, a proven, funded, federally administered health network. And the push to expand it threatened a future where government, not private institutions, controlled medicine. Lobbying began. Arguments were made that the system was inefficient, that private enterprise could do it better, that federal health care was somehow un-American, even though it had been American policy for nearly a century. Congress, flooded with banking and business interests post-Reconstruction, began to defund and dismantle. By the 1880s, the expansion was dead. By the early 1900s, the Marine Hospital Service had been quietly reorganized into something far more limited, eventually becoming the Public Health Service, stripped of its hospital mission.
This was a very different country. Instead, the vacuum left by the Marine Hospital Service was filled by private hospitals, private insurance, and private pharmaceutical companies. A system built not around patients, but around profit. And the people who built that private system made sure the public forgot there had ever been another way.
Every time a public system gains traction in America, whether it's healthcare, public banking, or public utilities, the same playbook runs. Call it radical, call it inefficient, defund it quietly. Let it fail, then sell the solution back to the public at a profit. The Marine Hospital Service wasn't dismantled because it didn't work. It was dismantled because it worked too well,
and the wrong people were in charge of it.
Now I want to hear from you. And I mean this genuinely. Did you learn this in school? Because I didn't. And I think that silence is deliberate. Drop a 1798 in the comments if this blew your mind. And if you think someone needs to see this, share it. History they hide travels further when we carry it ourselves. If you want the deep dive, sources, documents, the names of the people who killed this, I'll link everything in the description. And subscribe, because next week we're talking about the public banking system America almost had in 1913.